Well, good afternoon, everybody. Thank you for joining us again to talk about our response to be able to slow down the spread of coronavirus here in Nebraska. Today, we're going to be joined a little bit later by Sherry Dawson, who is our Director for Behavioral Health in the Department of Health and Human Services, and Annette Dubas, who's the Executive Director of the Nebraska the Nebraska Behavioral Health Organization. No, wait, I'm getting Association, the Nebraska Association of Behavioral Health Organizations. There we go. Sorry, and a former senator. So familiar to the building. Before we get kicked off there, I just want to, again, as always, remind people about we're on day 8 of our 21 days to stay home and stay healthy. We want people to stay home, stay healthy, stay connected. And of course, we've got our 6 rules. Stay home. Don't take non-essential trips. Work in a socially distanced way, 6 feet away, that kind of thing, or work from home if you can. Shop. Go out shopping once a week. Take a list. Be efficient. Don't take the family. 4, make sure you help kids socially distance by playing at home, avoid playgrounds, avoid those large group sports. 5, help seniors. Maybe you can go run errands for them so they can stay at home, or go shopping for them so that they don't have to go out. That's a great way to help keep our seniors safe. But don't go visit them in a long-term care facility. And then number 6, and finally, is exercise. And we're going to talk a little about this as well. Exercise for that, physical health. But we're also a little bit later today going to be talking about mental health, because that's going to be important as well. So again, follow our 6 rules to stay home, stay healthy, stay connected. Yesterday, I think that everybody saw that the president came out with his rules for opening up America again. And so it's got a phased approach into reopening the economy. So a couple of points I'd like to make about that is, one, that phased approach aligns with what we've been saying all along, right? That as we think about getting into May and loosening some of these restrictions, we were going to do it a step at a time in a very phased approach kind of way, the way the president had laid out there for as well. I think it's also important to note that was one document for 50 states plus all the territories. When you've got a country as diverse as ours, no one document is going to work as a one-size-fits-all answer. That when you think about the difference between New York, for example, and them having more cases than many countries around the world, if not almost all of them, just by themselves, or Wyoming that has very few, you've got a huge variety in the way that states have been impacted by the coronavirus. And so a one-size-fits-all document, it's not going to work. But I think that when you talk about how you phase these approaches in, that is something that works for everybody. So we're going to be taking a look at what the president has put out and using that feedback from our federal partners, as well as being in contact with our local partners and industry groups about, as we think about loosening these restrictions going forward, what that all means and how we will construct a plan that is right for Nebraska. Now, having said all that too, I would remind people, we're not doing anything different in April. Okay, we're going to continue to focus on stay home, stay healthy, stay connected here in April. So we're only on day 8 of 21. We got more work ahead of us as far as continuing to focus on those social distancing guidelines that we've talked about, these 6 rules, so that we can really, again, tamp down that virus here in our state. So please continue to remember April. We're going to focus on that. Again, one of the things we talked about was exercising daily in our 6 rules. We've talked about stay home, stay healthy, stay connected. Now, as we're social distancing, one of the things that may be difficult to do is to stay connected. And this can lead to isolation. People can become depressed, lack of that social contact. And it's important to think about your mental health just like your physical health. We've said as one of our 6 rules that we want people to exercise. Well, taking care of your mental health is also important. We want people to be able to do that as well, especially at a time when we're saying social distancing that could lead to that isolation. So there are a number of resources out there to be able to help folks who may be struggling with this. We've talked about the suicide prevention line, that 1-800-273-TALK. We've also talked about the Nebraska Family Helpline, the 1-866-866-8660. That if you're looking for that. We also have a Nebraska Rural Response Hotline at 1-800-464-0258. 1-800-464-0258. There's another resource, that Nebraska Rural Response Hotline. So there are resources out there for people who need somebody to talk to. Please take advantage of those. Talk to somebody. It's important to make sure we stay connected. And with that, I'm going to bring up Sherry Dawson, who's going to talk a little bit more about what we're doing in our behavioral health division, and then Annette Dubas will talk as well. So Sherry, I'm going to turn it over to you.